Overview: Small cell lung cancer, SCLC, is an aggressive disease that often spreads before symptoms appear. Most people have extensive stage SCLC at diagnosis. Extensive stage SCLC is very difficult to treat. The main treatment is combination chemotherapy, along with supportive care. The goal is to slow progression, manage symptoms, and maintain a good quality of life for as long as possible. Continue reading as we discuss treatments for extensive stage SCLC, a general idea of what to expect, and finding the support you need. Life expectancy: the outlook for extensive stage SCLC varies depending on your general state of health, age, and treatment. There is no cure for extensive stage SCLC. The goal of treatment is to slow disease progression and improve quality of life. With treatment, the median survival rate for extensive stage SCLC is 6 to 12 months. Trusted source. Without treatment, it's 2 to 4 months from the time of diagnosis. Extensive stage SCLC responds well to chemotherapy, but it can quickly become resistant. It almost always returns. Your doctor can discuss your outlook with you based on your medical records and treatments. Treating extensive stage SCLC: surgery and radiation generally aren't used once the cancer has spread outside your chest. The main treatment for extensive stage SCLC is chemotherapy. Treatment is designed to slow progression, lessen symptoms, and improve quality of life. Chemotherapy doesn't target a particular part of the body. It's a type of systemic treatment that can attack cancer cells wherever they may be. SCLC is usually treated with platinum-based chemotherapy drugs. In some cases, an immunotherapy drug called atezolizumab, Tecentriq, is used at the same time. Recently, a 2018 study found first-line treatment with atezolizumab along with chemotherapy drugs significantly prolonged overall survival versus chemotherapy alone. Immunotherapy can also be introduced after trying chemotherapy. SCLC tends to spread to the brain, liver, adrenal glands, bone marrow. Because SCLC often spreads to the brain, your doctor may recommend radiation to the brain as a preventive measure. Before deciding on a particular therapy, discuss treatment goals with your doctor. Find out how the treatment is given, the likely side effects, and what follow-up tests will be needed. Clinical trials. Clinical trials are another option. These trials test new chemotherapies, immunotherapies, and other treatments not yet approved for general use. Ask your doctor about clinical trials for SCLC, the risks involved, and whether you're a candidate. You can learn more about current clinical trials for SCLC from the National Cancer Institute trusted source. Palliative care. Whether or not you choose chemotherapy, you'll probably need supportive care, also known as palliative care. Palliative care does not treat the cancer itself but strives to help you maintain the best quality of life possible. This can include pain relief, breathing assistance, and stress relief. Your palliative care team may include doctors, nurses, social workers, therapists. If your airways are restricted, you can have photodynamic therapy. This therapy uses a drug called a photosensitizer and exposure to light at certain wavelengths. You'll be sedated as an instrument called a bronchoscope is passed down your throat and into your lung. The procedure can help open your airway. Laser therapy. Using a laser on the end of a bronchoscope, a doctor can burn parts of the tumor away. You'll need to be under general anesthesia. Stent. A doctor can place a tube called a stent into your airway to help you breathe. Pleural effusion is when you have a buildup of fluid around your lung. It can be treated with a procedure called thoracentesis. In this procedure, a hollow needle is placed in the space between the ribs to drain the fluid. There are also several procedures to keep the fluid from building up again. Chemical pleurodesis. Doctor inserts a hollow tube into the chest wall to drain fluid. Then a chemical is introduced to cause the lining of the lung and the chest wall to stick together and prevent future buildup of fluids. Surgical pleurodesis. During surgery, a medicine such as a talc mixture is blown into the area around the lungs. The medicine causes scar tissue to form, which makes the lung stick to the chest. This helps close up the space where fluid can collect. Catheter. A doctor places a catheter in the chest and leaves it outside the body. Fluid is regularly drained into a bottle. If fluid is building up around your heart, these procedures can help. Pericardiocentesis. Guided by an echocardiogram, a doctor places a needle into the space around the heart to drain fluid. Pericardial window. During the procedure, a surgeon removes a part of the sac around the heart. This allows fluid to drain into the chest or abdomen. For tumors that grow outside of the lungs, radiation therapy can help shrink them to relieve symptoms. Finding support. Many people find comfort in support groups, whether they're online or in-person meetings. Your doctor can refer you to groups in your area, or you can get more information from these organizations. American Cancer Society. American Lung Association. Cancer care takeaway. Extensive stage SCLC isn't considered curable. About 60 to 80% of people with extensive stage SCLC initially respond to chemotherapy, but the cancer almost always recurs. Everybody is different. Your doctor can give you a better idea of what to expect based on factors unique to you. It's important to ask questions and speak your mind along the way. It might help lean on loved ones and find support. The bottom line is that you should do what's right for you.